everyone. My name is Katie, and I am a pelvic floor physical therapist as well as the owner of ATL Pelvic Health. We are a specialty pelvic floor clinic in Atlanta, Georgia, and I am currently 34 and some change weeks pregnant. So today I wanted to show you some different exercises that I've been doing on my mobility ball or exercise ball to help my body and pelvis get ready for birth. What we're going to start with first is just some nice deep breathing. I like to give a little bit of tactile feedback by having my hands either on my rib cage or low across my belly. We want equal movement to be coming from your chest and from your stomach. We want to avoid doing a lot of breath here where our shoulders are going up towards our ears. So if you want, you can close your eyes. I like to, again, bring my hands to that rib cage to really get that lateral rib cage mobility opening up so my diaphragm can really expand. So you can take a nice deep breath in here. And then exhale, letting it all go. As we inhale, we want to think about our pelvic floor lengthening or dropping down towards the ball. So you might feel the tissue in between your sit bones falling towards your exercise ball. And then you're going to exhale, let it all go. Good. Imagining like a balloon is opening up underneath your rib cage as you breathe in. And then letting it all out. From here, we can move into some nice pelvic tilts. So if we think of our pelvis like a bowl, we're going to tilt our pubic bone up towards our belly button. The ball is going to roll. You're going to feel the ball roll forward. And then you're going to inhale as you tilt your belly button down towards your pubic bone. Think about tilting that ball forward in space. The ball is going to gently roll behind you. So you're inhaling and exhaling, matching your breath with movement here. Gently thinking about sticking your tailbone out behind you, really opening up the backside of the pelvis, and then rolling that ball forward in space, tucking under. Commonly, I will see people moving their legs a lot when doing this. You want to try to keep your feet and legs pretty still and let this movement come from your pelvis. As you roll the ball forward, you're tucking your pubic bone up towards your belly button. Your low back is going to round. And then as you inhale, reaching that tailbone back behind you, you're going to feel an arch in your low back. If we see it from the side, it's going to look like this. Inhaling as I extend. And then exhaling as I tuck and round. Once you've done some pelvic tilts and you're feeling really good in this position, the pelvis, the low back should be feeling nice and relaxed. You can start to add on with some circles. So now if we're thinking of that pelvis like a bowl, we're trying to move the bowl around in a clockwise direction. Again, my legs aren't doing the motion. The motion is coming from my pelvis. The legs are kind of following the pelvis and the hips. Moving with your breath, you can inhale for half of a circle, maybe exhale for half the circle. If that doesn't feel natural, you can try to inhale for a full circle, exhale for a full circle. And then we're going to reverse the direction. Again, really creating space in the low back, space in the pelvis. As you circle the hips. You can also just do some side to side sweeps of the pelvis going from right to left. I like to have my patients do this at home, especially if they're working a desk job. This is a great thing if you have a birth ball or an exercise ball that you've blown up and you can be sitting on during your work day. These are great movements that you can incorporate into your day already, especially if you're sitting a lot. We're really just trying to create, again, some space in the pelvis to make room for that baby to descend down. Then we're going to get a little bit more into our spine mobility. So you can step your feet out a little bit wider, take a nice deep breath in. Let the belly expand. As you exhale, drop your left shoulder down, getting a little bit of a gentle twist through the mid and upper back. And then come through center and switch sides. Feeling a nice stretch through the front of the shoulder, twisting through the upper back as you drop one shoulder down. And then come up through center, and then the other side. And then if you want to add on a little bit more side body, you can reach the arms up towards the ceiling. Take a nice deep breath in. As you exhale, let your left arm drop down inside between your legs. Right arm is going to stretch up and over. You could even twist your chest up towards the ceiling, opening it up a little bit more. Feeling a nice lengthening through your whole side body. And then stack your spine tall and switch sides, taking a nice deep breath in, thinking about it, rib cage expanding open, and then exhaling as you twist and reach to the opposite side. Right hand is going to fall in between your right, in front of your right knee and ankle. Left arm is going to be reaching overhead, again, really stretching and opening up this left side body, and then stacking up tall. I like to flow through these a couple of times to really open up those obliques, get a little bit of side bending through the spine. And then come all the way up. So these are some of the exercises I like to do seated on the ball. Next, we're going to do some kneeling exercises to open up the pelvis a little bit more. When we are thinking about pelvic opening, as it pertains to preparing for birth, you have a pelvic inlet. So if we think about the baby sitting in the uterus, in the abdominal wall, we want the baby to descend, to be in good position, and then to be able to descend into the pelvis through this inlet. So to create more space here, we want to be working on the hip external rotation. So it's this wide-legged position. And then for the baby to come out, we want this pelvic outlet to be really open and spread apart as much as possible. When our knees rotate in, we create more space in the outlet. So hip external rotation creates more space in the inlet, and then hip internal rotation creates more space in the outlet. So in this next video, we are going to prepare both our hip external and internal rotation to create more space in the pelvis to make it easier for the baby to descend through the vaginal canal. For this next series of exercises, we're focusing on our pelvic inlet and outlet and creating more space in the pelvis for baby to make sure baby is in optimal position for vaginal birth. To start, we're just going to do a kneeling hip flexor stretch. This is going to be able to stretch this area of the front of our hips, which can get really tight because of how our posture changes as our belly continues to grow. If we're spending a lot of time in the car, either commuting to work, sitting at a desk all day, this hip flexor area starts to get really tight, and it can actually start to pull on your round ligament, which can sometimes also start to lead to a little bit more round ligament discomfort. And so you can do this with or without a ball, but I like to step 1 foot forward. You're going to be kneeling with the bottom knee, the knee on the ground, right directly underneath the hip and the pelvis. And then similar to the pelvic tilts that we were doing earlier, you're going to think about pulling your pubic bone. So rather than sticking your hips back, you're going to tilt your pubic bone up towards your belly button. And you should already feel a stretch there. So again, I'm stretching this front part of my hip. And then I like to bring the same side of the leg that's down. That arm is going to reach up towards the ceiling. Keeping that nice tilt of the pelvis, you can start to roll the ball away from you, stretching over to the side for a deeper stretch. And then you can come back to center. And then you can do that again. Inhale, think about lengthening, keeping that shoulder relaxed down away from your ears, and then reaching up and over as you gently roll the ball away. And then you can bring your ball to the opposite side. So we'll do the same thing on the other leg. You're going to bring your right knee down. Left leg will step in front of you. Your foot is right below your knee. And then your right knee is right below your hip. We're going to tuck the pelvis. So pubic bone is going to reach up towards your tailbone. Right arm this time is going to reach up towards the ceiling. You're going to take a nice deep breath in, lengthen, and then roll the ball as you stretch up and over to your left. And then come through center. And then you can do that again. So your glutes are going to be active. You're maintaining that tilt of the pubic bone up towards the belly button to really open up the front of the hips. Inhale to lengthen, and then exhale, stretch up and over. This ball is also nice here to be a little bit of a balance for you. And then come back through center. So another thing I like to do for the hips and the pelvis is moving into a kneeling lunge series to open up the hips in a variety of directions. So you can start with both hands on the ball. One foot is going to step forward. You're going to reach the ball forward in space and then back. Reaching forward. Again, working on the opening of the front of the hips and back. I usually like to do 5 or 10 of these in each direction. So I like to start with my foot forward, going towards that 12 o'clock position, and then I'll open my foot out to the side, maybe like at a 1 or 2 o'clock position, and then we're going to roll the ball to the side. This time we're opening up a little bit more through the pelvis and through that inner thigh. And then you can just keep rocking forward and back. If you have any low back tension, any pubic bone pain, you may just want to decrease this range of motion, working in a range that feels supportive for your body. And then once you finish a few in that direction, the last position I like to walk so that my kneeling leg is at 3 or 9 o'clock, however you want to look at it on a clock, but you're really open perpendicular to the opposite thigh, and then you're going to rock that ball to the side. So again, we're trying to open up this part of our inner thigh muscles as we reach your knee forward towards your toes. So using that ball for a little bit of support as you rock forward and back. And then we can do the same thing on the other side. So I like to start with the foot forward, a little bit of a tuck of the pelvis, and then roll the ball forward as I stretch that front hip open, and then back. Again, making sure you're continuing to breathe as you do these movements. It can be common, especially towards the end of that 3rd trimester, that we're just holding our breath. However feels most comfortable for you, inhaling and exhaling. And then we're going to go last position here, really opening the pelvis wide and going to the side. So that's our 3-way kneeling lunge series. The next thing I want to show you is a couple of other mobility movements that you can do with your exercise ball. So you can use your ball to roll forward, sink down into that child's pose stretch. You can hold here for a couple of breaths, and then you're going to roll the ball towards you, stacking up your spine nice and tall. So in this position, your feet can be touching, your toes can be touching, knees come apart. And then you're coming up tall. To get a little bit more hip internal rotation, you can also rotate so that your feet are open, knees are closer together. And then same thing, you can roll the ball out and then stack your spine tall. And then roll the ball out and stack the spine tall. Those are some of my favorite ways to use your exercise or birthing ball to help prepare your pelvis and hips for birth. Please follow along. We will have more tips and tricks posted here on our YouTube channel. You could also follow us on Instagram at ATL Pelvic Health. If you have specific questions and you want to reach a member of our team, feel free to reach out at www.atlpelvichealth.com.